So now we will move on to the lower body treatment and evaluation. First thing I want to do to make sure that the patient is safe to work on without injuring her is I will do a gentle range of motion test to see how sensitive the nerve and the joint is. So here I'm checking the hip flexors and lateral rotators. I find there a little bit of resistance and a nerve compression from the piriformis and sciatic to the inside. I'm being very careful not to force the stretch, but just see where the joint moves naturally and where its end feel is. The end feel is where the tendon reaches its maximum stretch and then refuses to go any further. So we see here we have the hamstring is in spasm right now, as well as the piriformis around the sciatic is a little entrapped. Also, we have from the adductor magnus a limitation there. So I will gently check the hamstring. Okay, definitely sensitive, but not so inflamed or sensitive that it's unsafe to work on. So I will now proceed to work on the iliotibial band first and vastus lateralis in order to relieve the tension from this main tendon, which is very dominant, especially because on the L4, L5 herniation, the hernia protruded to the left side, compressing the transverse nerve as it's coming out down the outside of the leg and sciatic. So I've been monitoring this on her and making sure that every time when I come in here, I check this tendon, and this tendon is my main gauge in her progress. Today, I feel it's much stronger, as well as a little less tight than it's been the last 13 sessions. So I know that is making progress. Again, when I'm working, I want to make sure I position the leg in a nice aligned with the hip and with the foot before I work on it, so that I have a positive anatomical stimulation on that leg. I don't want it to be in any other position when I'm working on it than the position that I see is best aligned with the joints. Now I will move on to the peroneus, which is very interesting for her. When she first came in, this was one of the most sensitive points besides the pain in her back. And as you can still see, it's very sensitive there because it went into spasm when the L4 herniated. This is another one of my indicators on her progress, is this pressure point right there on the peroneal and on the tibial anterior right there. Now, about on the 6th session or so, she had a secondary injury due to all the stress from the herniation, and when she was stretching, which was not advised, but she felt like stretching, and she actually popped a part of the hamstring, the lateral head of the bicep femoris. It wasn't a complete tear, but just a partial tear, and that often happens when you're dealing with herniated discs, is that after the disc is herniated, there's all kinds of secondary injuries coming because the spine is unstable, and when people are walking around and going about their daily activities, they often have other injuries that result. So she actually ended up tearing a little bit of that hamstring, and then afterwards her symptoms got worse again. She had a relapse and was left with numbness along the peroneal nerve here, which she has lost a little bit of sensitivity here. Now, I'm very pleased because as we've been working, that numbness has gone away, and slowly the feeling is coming back. Originally when it happened, her toes actually went completely numb, but now she is starting to regain feeling in there. So I'm not so worried about that anymore. Now those kind of symptoms, when you see them, those are big red flashing lights. You gotta be aware of that and make sure that the person recovers or gets proper help, because there might be spinal impingement, which we know that there was. Now Liz is a candidate for open back surgery. That's what the neurosurgeons recommended, but she made the choice that she wanted to try natural medicine first and exhaust that before she went to surgery. And so we are here working on it, and so far so good, because she is making very good progress for this kind of an injury. So now I will move on to work on the Achilles. Again, I make sure that I have the body in a nice, aligned, anatomically correct position before I start working on it. Achilles is very sensitive today and has been. Part of the treatment for Liz that we are doing, aside from the acupressure, is I have her wearing ACE bandages in order to stabilize the ankle, which has become very unstable since the back injury. And I also had to change her shoes, because the shoes she was wearing, not only were they not good shoes, but they weren't offering the support that she needed. Now when people have a low back injury, the foot becomes very important for their recovery. If they have instability or any kind of congenital deformation in the foot, like Liz does, a flat foot, as you can see here, we know that this is a disposition for back pain, and definitely was a part, besides of the injury to the spine itself, congenitally she was disposed to have these problems because of her flat feet. So part of the treatment for her is not only getting her through this acute phase of the injury and letting the herniations to heal up, but also to change the arch of the foot so that she will have a stronger foot, and which will make her whole body stronger and her back stronger and prevent these kind of injuries from happening again. Now in order to do this, we have correctors. These are very special correctors. These are metal, which is the only material which is really strong enough to significantly change the foot. They are custom made, and they'll be worn in her shoes as a therapy. Even though she is 35, it is still not too late to correct these problems in the foot, and that will give her overall a better result. Now, in order for the correctors to be effective, we have to have a proper shoe to wear them in. These, although not very stylish, are very good to offer the support. I like how they have the heel and a whole round toe, and that they lace up tightly around to almost even splint the leg and act as a splint, because her lower leg had become very unstable, especially after the spinal injury, when actually I noticed in the first 6 sessions that her arch, aside from the numbness that started to happen, crippling her toes and her foot, also her arch started to collapse. So it was very important to stop that from happening, because oftentimes what happens in this kind of case is the person's spine gets injured and the low back gets injured, but then degeneration and other kinds of arthrosis, which is a hardening of the tissues, happen as a result of the nerve being compressed. So I want to maintain the health of the lower body and the function of the lower body through the process of healing. Because oftentimes people will heal from herniated discs, but then afterwards they're left with collapsed arches, or contracted Achilles tendons, or shin splints, or plantar fasciitis, and other kinds of joint injury that then becomes more of a problem in the future than the back injury itself, and then leads to further back injury. So we are taking this into consideration as we are treating her, not just for temporarily relief of the pain and the symptoms, but also to make sure that in the future she continues to rehabilitate and get better in order to prevent further injury to those now weakened areas in the spine. And also we are going back in time and correcting things that actually should have been corrected long ago. So now I am working on the vastus medialis, adductors, adductor magnus, and the sartorius and gracilis, and semimembranosus and tendinosus of the hamstring group. We do this all from the inner leg here. Again, a very sensitive area, and one has to be very cautious to apply a tolerable amount of pressure so that you can get a good stimulation without irritating the client too much, so that they don't contract. I do not want my patients, even though I'm working on very sensitive areas, I do not want them to contract in response to the pressure that I'm applying. So I go to the point where I start to feel the contraction, and then I back off. Now I work the Achilles tendon and the soleus from the inside leg. Here is an area where sciatic nerve impingement always wants to collect its pressure. And it's very important for the low back to relieve it from this part of the foot. Also, the sensitivity here tells you about the progress that the nerve is making and the inflammation in the low back. So now I will move on to the plantar tendon of the foot, which again, before I work on it, I make sure I properly line up the metatarsals with the knee in its best possible anatomical position that I can obtain, and then I work on it, relieving it in that position. Now, with the correctors and the proper shoes, which I will have her wear for the next year, and then continue to wear even for years afterwards, we'll begin to correct the posture of the foot, making her actually even better than before the injury in many cases. In Liz's case, on top of having several accidents which damaged the spine, her foot posture was also responsible for just daily stress and wear and tear on her low back. So it should not be overlooked, even though it wasn't directly responsible for the herniation. So now I will again check the range of motion after I've worked on it to see the response. And definitely I get a couple more inches and a lot less resistance in the movement. Now this leg was the most severely affected from the injury that happened 2 months ago. And so this is the one where I've been closely monitoring for improvement